So, we're going to be talking about personality disorders, but before we get into that, I just wanted to talk to you guys about your interview papers. They've been really great to read. I've been really moved by some of the people that you interviewed and just their struggles with mental health conditions. And as we know, it's really difficult just, struggling with something. I just wanted to touch on this because obviously we're a faith based institution and how people sometimes will use faith as a way to kind of say maybe that's why you're struggling with the mental health condition, like, you're not praying enough, you're not choosing joy, you're not doing all the things. And the reality is we can be doing all the things and still be struggling, right? And so we want to take that in consideration when we talk to other people, when we're trying to help them with like what they're being told or what they're being said. And the reality is when it comes to mental health conditions, people tend to have this attitude of like you should just be able to do something different and not have this problem, when the reality is if we're looking at a health condition like, for example, a heart condition where someone has high blood pressure even though they eat healthy, or high cholesterol because it's genetic, and you don't hear people saying, well, if you prayed more you wouldn't have high cholesterol. You don't hear people saying that. You hear them saying take your medication, do what you need to do, obviously have a healthy diet, exercise, do the things, but also listen to your physician. And for some reason, we don't say those same things when it comes to mental health. And so again, I'm not pushing medication, but I am pushing that we have this sense of like you should be able to do something about that. You shouldn't be depressed, you shouldn't be anxious, all that. We can have that kind of attitude, or people can have that kind of attitude. This is also why it's so important taking into consideration cultural implications from a lot of your papers. We saw the cultural components of how people treat mental health, and or how they can be dismissive of it or disregard it because they just don't believe in it. Also, this is problematic and causes a lot of pain and hurt and suffering for people that are suffering with mental health conditions. It probably has caused, as we read, or I read in a lot of your papers, people to have treatment put off because they're being dismissed constantly. If it's not that big of a deal, it's not that big of a deal. You're being dramatic, those kinds of things. And so when people come to you, this is potentially where they're coming from as a client, when they're coming to you as a client and you're the therapist. And so just having a greater understanding of that is important. I think it helps validate people because people feel very invalidated when people are treating them in this way. And you don't want anyone to feel that way, of course. And so I just wanted to share that with you, just for you to have that kind of mindset when you're going into therapy and working with clients, that you're being mindful of how you talk to people, how you treat people, and you might be the first person to really listen to them and hear them and validate them, because of how they've been raised in the experiences that they've been in. So anyways, just my little soapbox. I'll get off it now. We're going to be talking about personality disorders. So personality disorders is hard, right? They're tricky because, when we look at anxiety or depression, that's something that somebody struggles with, like it could be a genetic component. It could be due to like, just having a baby. So there's all these hormonal things going on. It could be situational, of course. When we're talking about personality disorder, we're talking about who someone is as a person. And that can be really hard and really sticky. And oftentimes personality disorders come from deep wounds, but that doesn't make the behavior okay. But that's oftentimes where it comes from. So personality traits commonly include openness, conscientiousness, agreeableness, and neuroticism. Extreme personality traits may cause problems and become personality disorders. So they often have an unusual way of thinking. They have usually not a very great way of expressing emotions, interacting with others, controlling impulses. When we think of personality disorders that get talked about a lot, we hear a lot about narcissism. That's a personality disorder. We hear a lot about borderline personality disorder, very tricky. There's also like obsessive compulsive personality disorder. There is dependent personality disorder. There is many, many different types of personality disorders. But some of the ones that you hear oftentimes are more of like the narcissism, borderline, things of that nature that come up that we hear about for other people to talk about. So I'm just kind of okay. So odd or eccentric personality disorder. So paranoid personality disorder involves a general distrust and suspiciousness of others. Those affected often read harmful intentions from neutral interactions, so they assume a lot about other people. Now, some of this could be brought on by other things going on, and that's why we always have to rule out if there's any addiction happening. Or sometimes too, some of these behaviors start coming out when a person starts developing dementia. We'll start to see a lot of paranoia, things of that nature. But that's where we have to ask questions like what's been going on? What kind of medications are they taking? Especially if it's a sudden onset, things don't usually kind of just happen suddenly. Then there's the schizoid personality disorder, involves social detachment and isolation. These people have little interest in establishing or maintaining relationships. And then schizotypal personality disorder involves interpersonal deficits, cognitive and perceptual aberrations, and behavioral eccentricities. They have extreme social anxiety and perhaps paranoia. Personality disorders occur in about 7.8% of the general population. Odd and eccentric personality disorders occur in 3.8% of the population. Odd or eccentric personality disorders are highly comorbid with anxiety-related, depressive, bipolar, substance use, and psychotic disorders. So that's where I'm saying it could be coexisting with something else that is happening. So then we have more of the dramatic ones, which where I was talking about with the antisocial personality disorders. This is where you have your psychopath or sociopath. It involves a pattern of behavior that disregards and violates the rights of others, deceitfulness, impulsivity, irritability, aggressiveness, criminal acts, and irresponsibility. Evident in childhood in the form of conduct disorder. So it evolves, right? Psychopath is related to an antisocial personality disorder and involves little remorse or guilt, poor behavior control, arrogance, superficial charm, exploitiveness, and a lack of empathy. So we see this in kids as they get older, kids who like to harm animals, harm other children. Sometimes we see this with emotional disturbance. And this is the thing. You aren't born emotionally disturbed. You're not born with conduct disorder. It like trauma and things are happening which cause a person to get in these kinds of situations. And this is very scary because there's no remorse. Like I think we were talking about there's some podcasters out there that like to talk about psychopaths, but there's like a flat affect. Something happens and they're thinking about like something tragic happens and they're not thinking about the tragedy. They're thinking about like, man, what I'm going to have for dinner. Just a detachment to actual things that most people would have some level of a response to. And this is where we get, some of the serial killers and things like that, which are, it's scary, right? It's scary. The people in prison, stuff of that nature. People who commit crimes and hurt other people and don't really care that they've done such things. Borderline personality disorder. This is a really tricky personality disorder, very hard to treat. They tend to idle between I love you and I hate you with people, have a lot of dramatic relationships. There's a lot of ups and downs and all over the place. Tend to have some sort of high risk behavior, whether it be overspending, overeating, hypersexuality. There could be drug or alcohol use, but something where it's like excessive. If you have a borderline in your life, you know that they go through friendships quite quickly, are on the ins and or outs of relationship with other relationships in their family. It's just a pattern of behavior, and very often they lack the acknowledgement of their participation in the problem. It's usually everybody else's fault. How could this happen to me? As a clinician, can be very draining clients because they're so demanding. Constantly there's something going on in their lives. And again, that idling between I love you, I hate you. One second you're the best therapist ever, the next second you're the worst. And so it can be a lot. It can be very overwhelming and very draining. So, but this is a personality disorder. I would say it's more prevalent in women. But that's not to say that it doesn't exist with males. Very hard for them to keep relationships. Very, very hard. You got histrionic personality disorder. This is like one that involves attention seeking. So they are usually pretty flirtatious, provocative in their speech and in their clothing. Very superficial, short, like shallow. But really, again, attention seeking is huge. And the narcissistic personality disorder involves grandiosity, need for admiration, a lack of empathy for others. Those affected have an exaggerated sense of self importance and believe they are so unique that they can be understood only by similar special people. Again, this is one of those ones where you see this often. We just actually at my office, we did a little training on covert narcissism, and that's more or less like it's not obvious that the people are narcissistic, but if you spend any time talking to them, it becomes more obvious and kind of fly under the radar, but never their fault, always the victim. Narcissists really don't get it. Like they could be bagging on someone or making comments about someone and they do the same exact thing and just do not connect the dots. I mean, really have a hard time with their ego seeing themselves for who they are. Very fragile ego. Dramatic personality disorders occur in 2.8% of the general population. Specific disorder prevalence rates: antisocial personality disorder 1.4%, borderline 1.8%, histrionic 0.6%, and narcissistic personality disorder 1.9%. People with antisocial personality disorder commonly in substance use treatment, forensic, and prison settings. That's where we're going to see them. Borderline personality disorder is most frequently diagnosed personality disorder in inpatient, outpatient settings. A lot of times with borderline, you're going to have a lot of self-harm potentially, and that's where you're going to see them in and out of inpatient and or outpatient settings. Borderline personality disorder closely associated with substance use, depression, and suicidality. And like I said, a lot of these personality disorders coexist with other disorders just because of the nature of the disorder and like what it brings on. I would say, a lot of times people will say, oh, this person's such a narcissist. You got all these reels on Instagram and TikTok and whatever. Sometimes people maybe aren't truly a narcissist. They have narcissistic tendencies, which that's different than being a flat out narcissist. So I just want to put that out there. Someone could have narcissistic tendencies and not necessarily be a narcissist. So just something to be mindful of, just to be aware of, that could be what somebody's dealing with. But we do see it with people often. Okay. So the anxious and fearful personality disorder. So avoidant personality disorder involves pervasive pattern of anxiety, feeling inadequate in social settings. Dependent personality involves pervasive excessive need to be cared for, leading to submissiveness, clinging behavior, and fears of separation. So almost like separation anxiety, but for a grown-up, right? This is problematic behavior. A lot of codependency for these people, no decision making. And that's very problematic if they're with someone who is not a healthy person, right? Very scary. Obsessive compulsive personality disorder involves a preoccupation with orderliness, perfectionism, and control. Those affected are rigid, stubborn, perfectionistic to the point that tasks are never completed. It's too hard to get anything done because they're so fixated on how it should be done. Very, very debilitating. Can really affect someone and how they deal with their day-to-day life. Okay. So anxious and fearful personality disorders occur in 5% of the general population. Specific prevalence rates have been reported for avoidant 2.7, dependent 0.8, and obsessive compulsive 3.2. Anxious, fearful personality disorders are often comorbid with anxiety-related depressive and somatic symptom disorders. So, and when we're talking about somatic systems, they might have medical conditions or medical things that come up as a result of the anxious, the anxiety their body's under all the time. And so it might rear its ugly head as like an ulcer, or, maybe they have chronic headaches or body pains or things of that nature that go along with whatever they're suffering with because of the constant worry and anxiety. Okay. So personalize the stigma. Yeah, I would say there's a lot of stigma. Also, too, I think a lot of people are burned. And so when you then find out someone has a personality disorder and you've been with someone who's been that way in the past, there's some frustration and some fear of getting burned again. And so, it's one of those things that you have to be very conscientious of. And I think we need to, as clinicians, every disorder is different, even if it is the same disorder. And so we just have to be mindful of that too, that we're not just assuming things about somebody, that we're taking into consideration like who they are as an individual, their individual things that have happened to them that have caused them to be the way that they are, because we don't want to assume. We just never want to assume anything about anybody. And we want to, give everyone the opportunity to explain themselves and to explain who they are and what they're going through without us making an overall generalization, right? And so many mental health professionals still view personality disorders as incurable, which isn't entirely true. However, like, it takes a lot to convince someone that they're the problem, and it's who they are. So there's a lot of undoing. Like, for example, borderline personality disorder, very difficult disorder to deal with as a clinician. A lot of people use DBT, but I think when someone realizes they are the problem and they really want to make changes can be made, but getting them to that point can be really hard. And we probably know that about a bunch of different stubborn people in our lives that have maybe not a personality disorder, but just are problematic people, that it's really hard to get them to see themselves in a way that isn't, benefiting them or that they see as accurate when they feel like they're the victims in situations. It's really complicated. And so it's getting people the right care, the right treatment. And I think with treatment for any client, you really have to be ready to face whatever you got to face. And if you're not ready, you're not going to get the most out of therapy. And this is the same with a personality disorder. Okay. So, it's not really a genetic problem. I would say abuse or trauma is definitely abandonment. Those kinds of things are what start something with a personality disorder. Now, some of the more eccentric personality disorders, there could be other factors going on, right? Like schizophrenia or things like that going on. But with these particular disorders, there is probably, like a lot of the other ones, there's probably some sort of hole that happened in their heart that never got dealt with. And as a result, they've created this pervasive pattern of behavior that has become more problematic for them. So I hope this is helpful, a little insight into personality disorders. You'll definitely come across them, definitely come across people with tendencies. It's just a matter of not giving up and acknowledging like this might be a long road, or you might just be part of their journey as a clinician. But you definitely will see it, and you'll definitely work with people who have people with personality disorders in their lives. So be on the lookout because it's going to happen. I hope you guys have a great week.